Nursing Administration from the University of the Philippines and Bachelor of Science in Nursing from Bulacan State University. I am proud to have passed the NCLEX oral examination stopping at 75 questions and hold nursing licenses in both the Philippines and in the United States, specifically in Illinois and in New Mexico. Additionally, I am also a CGPAD certified and have successfully passed the Pearson test of English. All right, so the PTE academic. Okay, so as you can see here, with over 15 years of experience as an NCLEX RN lecturer and professor, I have had the privilege of training and mentoring many aspiring nurses. So my expertise spans on nursing education, what else? Sales, leadership and management, and utilization review and management as well. Of course, I am proud to say that I am also an active member of the Sigma Theta Tau International Honor Society of Nursing, Alpha Alpha P chapter in UP Manila. All right, so our topic for today is all about, okay, this one is a very special module. All right, I'm very excited to share, some sneak peek, okay, into my, actually this one is a comprehensive 4 to 5 hour discussion on ACE NCLEX in 85 questions. All right, so the session will focus on, mastering test taking strategies, which I know this one is a crucial aspect of NCLEX success, right? So kasi maraming nag-struggle dito, my dear nurses, right? Okay. Another one, why focus on test taking strategy? Because whenever I conduct session or lecture to my students, no, I will tell to them that for you to pass the NCLEX art examination, okay, it must be two things. Okay, so first is, okay, a solid mastery of the concept, or of course that's the foundation, which is of course the nursing concept, and then the other one is, okay, a solid mastery of the test taking strategy, right? So we all know that, many candidates fail not because they don't know the content, but because they struggle with what? With understanding NCLEX style questions, like eliminating the distractors, what else? Applying the clinical judgment under pressure, because we all know that, okay, when you are on your actual NCLEX art examination, you will be given 5 hours, okay, to answer your exam, and I know it's really really under pressure. Okay, so the NCLEX is not just, recalling about the facts, right? So it's about, thinking like a safe, what else, competent and effective nurse. So it's very very important, okay, to use your critical thinking and your clinical judgment, right? So let's just, okay, let me just share my screen for, okay, our module for today. Okay, one sec. Okay, so can you please confirm, my dear nurses? Let me just check. Okay, the chat box here. We have, okay, RN Nightingale Stanley, hello. We also have here Rima. Okay, Rima. Okay, we also have here, okay, RN Nightingale is from Kenya. Rima is from Kingdom of Saudi Arabia, Jeddah. Okay, Jamaica. Hello, Glacia. Okay, how are you? Okay, ayan, sige. So we have our dear international students here. Okay, so for our first part of our test taking strategy, okay, okay, it's very very important to take down notes, all right? So this, okay, this will help you, okay, on how to answer. Okay, for example, you have your own Q banks, you're answering Q banks, okay, you're struggling with, answering different case study. Okay, so this one might help you, okay, ace your case study, right? So when it comes to the test taking strategy, okay, it's very very important to what? Read the entire question carefully. Okay, so I always tell my student, like, it's very important to read the question 2 to 3 times, right? Because sometimes, okay, the common mistake or error that they commit, like, they fail to, okay, for example, they didn't read a particular question, like asking, like, for example, needs for further teaching. So sometimes hindi nakakasama, no? So it's very, very important to read the question carefully 2 to 3 times. Sometimes, okay, most of the NCLEX question for the standalone question, for example, a multiple choice, okay, it's a 2 paragraph. So it's very, very important to read the situation, the case being presented. Okay, who is the patient? Okay, who's the patient is very important. Okay, to know what is the age group. Is it a pediatrics? Is it an elderly? Is it an adult? Because most of the time, okay, when it comes to prioritization, okay, we give the highest priority to 0 to 5 years old, right? So what else? It's very important to read and analyze the question that is being asked. Okay, and of course, um, okay, on the particular scenario, is it an assessment question? Is it something related to asking for specific health teaching management? Okay, it's very important to answer, okay, regarding the question, or it must be related to the question being asked. Is it an assessment? So therefore, you will give an assessment answer. Okay, so how are you going to apply this one? Read the entire question carefully. Okay, so it's very important to read the question in full before looking to the answer choices. Okay, because most of the mistakes that they have committed, okay, they tend to look for the options. Okay, it's very, very important that you analyze. Okay, so sometimes NCLEX will not give, okay, the complete diagnosis of your patient. Okay, rather they will give, okay, an assessment. Okay, so this is the chief complaint of your patient. What else? And of course, the pathognomonic or the classic sign. Okay, and for the questions, sometimes NCLEX will ask for the specific health teaching, and it's very important to look, okay, for, okay, what type of question is being asked. Is it an assessment? And you should, okay, understand, okay, you should understand and use your clinical judgment. As a registered nurse, you must have a solid understanding when it comes to what? Okay, the classic signs, right? The pathognomonic signs of the disorders. Okay, because that will lead you to the correct health teaching, to the correct management. Okay, if it's asking about for the select all that apply, okay, so later we will have a separate discussion of the select all that apply. If it's asking about a particular, for example, clinical manifestations, okay, we have a separate test taking strategy for example, a clinical manifestation. Okay, so identify the type of question. This is what I'm talking about earlier. Is it an assessment? Okay, so it's very important, okay, that it requires what? Gathering of information. Okay, so if the question, for example, the topic is all about bronchial asthma, and yeah, you've noticed that most of the options, okay, or something to do with bronchial asthma. Wait, teen, why are all of the options are correct? Okay, oops, baka may na-mislook ka lang. Alright, so always go back to the question. Okay, is it asking for a management? Is it asking for an assessment? Right? So of course, if it's asking for an assessment, okay, so give an assessment answer. All right, so that's your NCLEX. NCLEX will just focus on the safety. What else? Do not, okay, go further or beyond the question. Okay, sometimes, okay, the student tends to, fight with the question. Inaawa yung tanong, my dear nurses, ano? Okay, one tip that I can give to you, my dear nurses, is that kung anong tanong, yun ang sagot. Alright? Okay, do not think out of the box, but of course, it's very, very important if, okay, this condition, okay, for example, then, papaano yung do not think out of the box? I mean, yung mga what ifs mo, remove the what ifs, but of course, on your subconscious mind, okay, hindi pa rin mawawala. Okay, that you're aware of the complication that might arise, okay, in this, of course, particular situation, right? But of course, no to what ifs. Right? So what else? If it's asking for an intervention, it focuses on what? Okay, on the actions to resolve a problem. A specific management, right? Specific management that you're going to, of course, do. Okay, you're going to implement. What else? Okay, if it's asking about the outcome, okay, it has something to do with the it evaluates whether a goal is met, right? And it's very, very important after you identify the type of question, okay, it's very important to what? Okay, look for the keywords. Okay, there says, okay, listen, right? Okay, on the actual NCLEX or an examination, okay, the day of your exam, okay, you will be given a board. Okay, listen. You will be given a board. So that board is like a graphing paper that is laminated. Okay, so that will serve as, your scratch paper wherein you can write everything. And what else? You will be given a permanent marker. Okay, so meaning you need to, okay, write legibly. What else? Okay, like be organized. Okay, because based on research is very, very important to what? Okay, do the rationalization, okay, on the board, okay, that was given to you for your actual examination, diba? So you will be given 5 hours to answer the exam. Okay, do not be in a hurry. Walang madalian. Okay, it's 5 hours. Actually, 5 hours is super long. Okay, and of course, our goal is to stop at 85 question. Teen, you're expecting a lot from us because I know that you can do it. All right? I know that you can do it as long as you will apply all of the test taking strategy and the concept. Of course, that it must be a combination of both, right? Okay. Actually, earlier I've mentioned that, okay, this module is around 4 to 5 hours. Yes, because for the test taking strategy, napakadami nating mga test taking strategy na po pwede nating mai-apply, no? It's very, very hard to, sit and of course answer up until, okay, 150 question, right? You must prepare yourself, okay, to stop at the minimum number of question, and it's doable, my dear nurses. Again, it's doable, right? So it's very, very important to maximize the board. Okay, so it's very important to write down, for example, question number 1. Okay, who is my patient? So write on the board, okay, write on your scratch paper. Okay, right on the scratch board, okay, that was given to you. Okay, who is your patient? Is it a pediatric? What is the case? All right, is there a time frame? Okay, because time frame matters here in NCLEX, right? So what else? Look for the keywords like this one, the first, okay, and this one usually you will notice, okay, to appear these keywords on the question. Okay, what is the most important thing to, of course, initiate, like for example, asking about the prioritization. Yes, okay, especially in the emergency cases. Okay, for patients arrive into the emergency department, who would you prioritize? Okay, so something like that, right? So for example, we have here question. The nurse is caring for a patient with chest pain. What is the priority action? Let me just check for the chat box here. Can you send the session recording to my email? Hi, I'm from Jamaica. All right. So yes. Okay. So it's very important. Okay, because on your actual NCLEX or an examination, you cannot highlight like what I'm doing right now. I'm, for example, a student asked me, Tin, can I highlight on the actual exam? Okay, no. Okay, so, but you can write on the board, okay, that was given to you, okay, using the permanent marker, no? So it's very important to rule out, is there a particular age group here? Okay, no, that was not mentioned. Okay, so what else? Okay, what is the diagnosis of the patient here? Okay, but, okay, there's no particular diagnosis, but for the manifestation, there is what? Okay, chest pain, my dear nurses, no? And the question is asking for a very, very simple priority action. Okay, so you will expect that NCLEX will ask you something about, emergency cases. Okay, because NCLEX will test your clinical judgment during emergency cases. Okay, so how are you going to implement? Okay, and of course, okay, execute, okay, this type of scenario, right? So what is the priority action? Okay, so how are you going to answer this one? So we all know that when it comes to the prioritization, okay, the first priority or the parameter that we're going to utilize is your ABC. Okay, so ABC stands for your airway, what else? Breathing and circulation. Yes or no? Yes. Okay, another parameter is we can also use the nursing process. Okay, so if the ABC is not applicable, okay, but okay, you've noticed that there's, a specific, for example, implementation, like there's an implementation of the health teaching, etc., etc. There is an assessment type, so the nursing process is applicable here. Okay, and one of the parameter when it comes to the prioritization is the nursing process. Okay, so rule of the thumb, okay, it always to start in assessment, what else, followed by the diagnosis, followed by the planning, implementation, and last would be the evaluation. Okay, as a registered nurse, we must have a solid understanding when it comes to the assessment, right? Because what I mentioned earlier, sometimes NCLEX will not mention for the specific diagnosis. Rather, they will focus on the chief complaint and asking for the priority action. Okay, like this one. Okay, letter A, administer prescribed nitroglycerin. Actually, when you analyze this is the drug of choice for chest pain, right? Okay, your nitroglycerin. Okay, so notify the provider of the patient's chest pain. Actually, this one can be applicable if the for example, the nitroglycerin is not effective. We can call the HCP, document the patient's symptoms. It depends on response of the patient. Okay, so assess the patient's blood pressure and oxygen saturation. So there's a confusion between, okay, three options, right? So I believe, yes, you have confusion. But of course, okay, going back to our parameters when it comes to, okay, following this test taking strategy, okay, if the ABC parameter is not present or is not applicable at the moment, we can utilize the ADPI. All right, your assessment or the nursing process. And the first parameter on the nursing process would be, okay, what? The assessment. Okay, so what reflects an assessment answer here? Because it's asking about the priority action. Okay, of course, that would be your, okay, let me just check for the chat box here. Anyone, my dear nurses? Anyone, what's your answer? Okay. All right. So what's your answer, my dear nurses? Of course, that would be yes, we will always start in the assessment. Again, we will always start in the assessment. So this is the correct answer. Yes, we can administer the prescribed nitroglycerin. Okay, of course, after the assessment. Okay, yes. All right. So assessment before the implementation. Okay, so notify the provider. You will notify the provider after you provided all of the independent nursing action. And afterwards, you can now, okay, call the HCP after you perform, okay, all of the independent nursing action. Okay, so the answer here is assess the patient's blood pressure and O2 saturation. Okay, very good. Okay, so that's the priority, ha? Okay, so next parameter would be, okay, the use of the process of elimination. Again, my dear nurses, you will be given a board. It's like a graphing paper that is laminated and a permanent marker. It's very, very important to write down all of the relevant words. Okay, that would be the keywords. Okay, and if it's very important that you will maximize that, especially when you are, okay, applying this power of elimination. Okay, use the power of elimination. Okay, so why? Because for example, for the standalone question and for the multiple choice, okay, it weighs like 25% each. Okay, to a total of 100%. If you eliminate, like for example, two options, okay, so meaning 50-50 chance of getting the correct answer. So I hate like telling to my student, like, guessing like mini minimo, like A, B, C, D. All right, so something like that. Okay, so if you didn't know the answer, read again the question 2 to 3 times and then use the power of elimination, right? So eliminate answers that are clearly incorrect or unsafe. Anything that reflects, all right, being an unsafe nurse or an unsafe procedure. Okay, so eliminate that. Okay, so what else? anything, for example, the absolute terms like only, what else, always, most of the time they are incorrect. Okay, so to eliminate that. Okay, so evaluate the remaining choices for plausibility and alignment with the ABC, because our yes main parameter would be the ABC. Okay, and it should be aligned to the ABC, right? So is it asking again for an assessment, okay, diagnosis, etc., etc. Okay, and your answer must be relevant to the topic. Again, your answer must be relevant to the topic. Okay, so for example, we have here a question. A patient with pneumonia has an O2 saturation of 88% and a respiratory rate of 28 breaths per minute. What should the nurse do first? What is the keyword here? Do first. Okay, so meaning, okay, NCLEX is asking about your, okay, priority, okay, on this question. Okay, what else? What are the relevant words, okay, that can be written on your board? Okay, you can write down pneumonia and the auto set of 88% and then RR of 28. Okay, so what is your action here? What is your action? Okay, so okay, we have here the parameter of ABC, airway, breathing, and circulation. Okay, that's, okay, what ABC stands for. Okay, and it should be addressed immediately, especially if it's something about this ABC. Okay, so here pneumonia is a respiratory problem, and we have here an auto set of 88%. Okay, it's very, very obvious that there is an airway compromise here. Okay, so meaning anything that is not related on the airway compromise, okay, you will eliminate those options. Again, you will eliminate those options. Okay, so like this one, check the patient's temperature. Is it related? Okay, is it related? Actually, that one is not related to the respiratory distress. Okay, so except, okay, in if here in the question it was stated that, oh, there's a fever, there's a problem in the temperature, but okay, nothing, right? So the temperature is unrelated to the respiratory distress. Okay, so only the autosat and the RR was given. Okay, so do not think out of the box. All right, if it's not there, it's not there, it's not related. All right, so meaning we will eliminate this letter D. Okay, again, we will eliminate this letter D. What else? Administer prescribed antibiotics. Okay, what else? Notify the provider immediately or apply, okay, oxygen via nasal cannula. So actually, notifying the provider and administering the prescribed antibiotics, like this one is okay, can be delayed. All right, so the patient is experiencing, okay, a respiratory distress, and this, okay, this needs to be addressed immediately, right? Okay, so of course the correct answer would be letter A. Okay, apply oxygen via nasal cannula, right? Okay, so letter B, yes, it delays the care. So it's very important during emergency cases. Yes, meron ka munang gagawin, guys. Okay, do something. Okay, do something first. Okay, independent nursing action, my dear nurses, before calling for the HCP. Alright? Okay. And we all know that letter B and letter C, okay, can be, of course, okay, can be part of the management, but okay, antibiotics treat infection but won't immediately resolve hypoxia. Our problem here is, okay, there is an airway compromise. Right? So, matatagalan pa kung magbibigay ka ng antibiotic dito, guys. 'Di ba? Alright. Okay, sige. Yeah, so at least we, okay, as registered nurse, okay, we perform a safe, what else? And it is aligned to the ABC parameter. Okay, so next, another parameter is focus on what the nurse should do independently. So actually, this was discussed earlier. Okay, but okay, sige, discuss na rin natin ito. So it's very important to look for options involving actions within the nurse's scope of practice. Uy, it should be within our okay scope of okay practice ha. Okay, if it's beyond our practice, it's a big no-no. All right? Avoid answers suggesting unnecessary or escalation unless critical. Okay, so we have your sample question. A patient reports dizziness after receiving a dose of antihypertensive medication. What should the nurse do first? Okay, so I will read it again. A patient reports what? Dizziness. Okay. So it's very important to write down on your board. Okay, what is the chief complaint of your patient? Because on the actual exam, okay, NCLEX would focus, okay, on addressing what is the problem, what is the chief complaint of your patient, and it should be relevant to the chief complaint. Okay, so after receiving a dose of antihypertensive medication, asking for okay your priority action. Okay, so it's very very important to what? Okay, assessment, right? Okay, very good. Assess the patient's blood pressure and heart rate. Okay, because like this one, notify the provider. Okay, this one is like before you call the HCP or the provider, okay, you should do something about the condition of the patient. Okay, by what? Okay, within the scope of our practice, okay, by assessing the patient's BP and heart rate. Okay, so this is the correct answer, letter B. Okay, so what else? Hold the next dose of the medication. Okay, we can hold this one if there's okay an order from the HCP. So it's very important that assess first. Okay, so that's the best answer. Okay, so okay, next. Okay, next. I think this will be the last. I know it's kind of okay, kapos, no? Okay. Okay, ayan. So, bitin. Another okay, task taking strategy is consider the patient's age, what else, developmental stage, and medical history. So it's very very important that you can recall okay the different age group. Okay, for example, infant, what else? Okay, infant is 0 to 12 months. Okay, for the toddler, 1 to 3 years old. Okay, preschooler, okay, 4 to 6, and school age 6 to 12, so on and so forth. Okay, it's very important as registered nurse, okay, that you know how to approach, okay, okay, yung approach mo, my dear nurses, ano, okay, tama, okay, tama siya, and of course, it's relevant, it's, kumbaga, it's applicable to the age group. Okay, how are you going to approach an adolescent patient? Okay, how are you going to approach a toddler? Okay, a toddler, something like that, because we have a developmental stage. Okay, and of course, what else? Okay, the expected behavior of the toddlers, something like that. Okay, you must not be surprised whenever the toddler is like not sharing toys. Okay, you should be aware of that, ha? Okay. So please go back to different developmental stages. For example, Piaget, Eric Erikson, Kohlberg, something like that. All right. So for example, okay, we have here a question. A 6-month-old infant is brought to the clinic for a well child visit. Which finding is of concern? Okay, so it's very, very important that, okay, you need to highlight, okay, write down, okay, who is the patient here? What is the age? Okay, we have here a 6-month-old infant. And yes, okay, as I mentioned earlier, this one is priority. Okay, of all age group, okay, infant is our priority, 0 to 5 years old. Okay, so actually the answer here is, okay, it's very very important that you know what are some of the physiological changes, okay, meaning the normal changes in a particular stage, right? So here we have different choices. Okay, the correct answer here is, okay, very good, it's letter B. The infant has not doubled their birth weight. Okay, okay, so which finding is of concern? Okay, is of concern. So meaning we are looking for what? Okay, aside from the age group, okay, we are looking for of concern. Okay, ayan. So, kailan ba tayo kailangan ma-alarma? Okay, it is of concern because this one is something that is abnormal, my dear nurses. Okay, the answer here would be the letter B. The infant does not double their birth weight because by 6 months, an infant should have a double, okay, their birth weight. Okay, you should know okay, what are the normal developmental stages for the infant. Okay, their normal weight gain. Okay, ayan. So everything about, okay, consideration of the patient's age. Okay, for example, your patient is an elderly. What are the physiological changes? Okay, in the elderly. So meaning that's expected, right? Okay, so it's already 9:32, and I know, okay, you've learned a lot and you want more. Okay, but don't worry, in our next session we will be providing, okay, more testing strategy. Okay, what else? When it comes to the mastering your prioritization, okay, we will have a separate discussion of that. All right, so yeah, okay, my dear nurses, I would like to thank you guys for joining me today. Right, so of course, I really, really appreciate your presence. Okay, so let me just give a shout out to Sean. Hello, Sean. All right, so I really, really appreciate your presence today, no? Okay, ayan, sige. I hope marami tayong natutunan, guys. All right, and see you on our next session for AMN Academy. God bless everyone. Bye bye. Again, this is Tin. Have a great day.